All right, so we've got a patient coming to the clinic with a really painful lesion in the forefoot here. We're really suspicious this one's a corn just by the look and the history that they've given. So you can see when we get in close there, you can see it's got this hard central section. It's got this really thick callus, extends most of the way all over the forefoot. So basically, as usual, we go in there and just remove as much of that overlying callus. Now, we're using the larger blade on this one because it's a little bit bigger area. So this is a number 10 blade. It's a little bit bigger than the 15. So we go ahead and remove all that callus, and then you can start to see that really dense central section there. And fortunately, this one's a very similar shape to the actual scalpel blade that we're using, so we can get quite a bit of it out without using the tip on this one, because when we use the tip, it's more likely to cause blood and pain. So we can get in there, really get stuck into that one and remove some of that corn. You can see the really big chunks coming away of it now. And then you can see then you've got the hard central section, but also around that you've got that macerated tissue that's a little bit deeper, where all the tissue fluid's been pushed deep into the skin due to the pressure of the surrounding corn. So these can be really quite painful. And this person actually limped in not knowing what she'd done to her foot. So we've just got to be a little bit careful on this one. We don't take too much on the first go because it can be very, very sensitive if we take it all out, even if it doesn't bleed. Sometimes we get a little bit of blood when we get right to the bottom of these, but not often. Obviously, we try and avoid it because it's an infection risk. So we're down pretty much at the level where we can, we've removed all that overlying cap. I have to go in there with the tip now. And so we're just basically cutting around the edge of that macerated tissue, and then we'll smooth that out. So we'll try and get the central section out, see if we can get it all in one piece and show you. But it's really important when we're at this stage, we're looking at the patient and looking at the corn, seeing how far to go and how much it's actually hurting. We try and do this, as painlessly as possible. And quite often they are painless to remove. So you can see we've got that large central section out. So we'll go ahead and smooth those edges now, and then we'll probably leave that one there. We'll do the others on this foot in another video. That's what it looks like when it's come out, and we'll get this patient back in about 3 or 4 weeks, and then we'll go and completely remove everything.